go to the doctor often? Lansing resident Priscilla Dever goes about once a month and is sometimes frustrated.
It usually takes like about 45 minutes to an hour, and it does take a minute for a while for them to get the prescription.
And lawmakers are trying to do something about it. There's a Senate bill that would allow advanced practicing nurses to sign prescriptions without physician approval. Dr. Gretchen Schumacher is president-elect of the Michigan Council of Nurse Practitioners and a nursing professor at MSU. She thinks advanced nurse practitioners should be able to prescribe drugs to patients.
And to clarify, Senate Bill 68 does not advance the scope of practice of APRNs. This bill only seeks to allow us to practice to the full extent of our education and training.
But some doctors groups don't agree. Dr. Tina Tanner is president of the Michigan Academy of Family Physicians. She says, quote, the bill would, in practice, expand the scope of practice of APRNs, allowing them to perform critical acts and functions independent of a physician. Now, advocates for this bill hope to not only allow nurses to sign prescription for patients, but to also address a future shortage in practicing physicians. Schumacher says over half of Michigan is considered to be in a health provider crisis because there are not enough doctors.
This is not something where we're competing with physicians in any way. There's too many patients for all of us. We need everybody. It takes a team.
Dr. Tanner says physicians should always be involved, especially when it comes to addictive drugs. She says, quote, in the interest of patient safety and public health, prescribing privileges pertaining to these drugs must require an established relationship with a physician, end quote. Whatever happens, patients like Priscilla hope they get the care that they need.
Sometimes you think that maybe they might forget about you because they're so busy.
For Focal Point, I am Tyler Clifford.